Minnesota's bold move, vaccines without prescriptions. When it comes to public health decisions, Minnesota has taken a stand that challenges the federal government's guidance on COVID-19 vaccinations. By granting pharmacists the authority to administer vaccines to a broader group of people than the FDA recommends, the state is redefining how its residents access critical protection. The Minnesota State Epidemiologist Dr. Ruth Lynfield explained that the goal was to simplify access for Minnesotans. "We wanted to make it easy for Minnesotans to go to a pharmacy for their shots," she said, emphasizing that vaccines are one of the most significant public health achievements in modern medicine. This includes not just COVID-19, but also protection against influenza and RSV, especially as respiratory disease season begins. This week, the State Department of Health announced a new policy that goes against federal recommendations. Historically, Minnesota followed the FDA and CDC, but that changed after President Trump appointed Robert F. Kennedy Jr., a well-known vaccine skeptic, as his health secretary. Kennedy then placed skeptics on the CDC's ACIP committee, which recently decided against recommending the vaccine to anyone, urging individuals to make their own medical choices. However, major medical organizations representing pediatricians, family doctors, and obstetricians have consistently urged unrestricted access for people 6 months and older. Minnesota has now aligned with these recommendations, and even the AHIP, a national health plans trade group, advised its members to maintain coverage for the shots. Until now, pharmacists in Minnesota could only give the latest vaccines without prescriptions to those 65 and older or with underlying health conditions. The new standing order allows pharmacists to vaccinate anyone 12 and older seeking protection, even as the virus remains a persistent threat years after the pandemic. The order highlights the importance of vaccines for unvaccinated individuals, long-term care facility residents, and those living in high-risk environments. A second order also enables pediatric doses for children aged 3 to 11 if parents choose. But here's where it gets controversial. While the federal government has been criticized for ignoring scientific evidence, Minnesota's action has sparked debate. Some argue that the ACIP has become an ideological body rather than a science-based one, as noted by Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy. Complications from vaccines are rare, but they do occur. Some Minnesotans have reported severe side effects after vaccination, including tinnitus and heart-related issues. However, studies show vaccines still offer significant protection, with a 33% effectiveness rate in preventing ER visits and over 40% in preventing hospitalizations among seniors. This decision came under pressure from Governor Tim Walz, who expressed concern that federal authorities were overlooking scientific research. Other states, like Wisconsin, have followed suit, showing a growing trend of states prioritizing local health needs over federal mandates. And this is the part most people miss. Even though the risk of severe illness has decreased, the protective benefits of vaccines remain strong. As Dr. Gregory Poland of the Mayo Clinic stated, despite possible side effects, the benefits of the vaccine far outweigh the risks. What do you think? Should states prioritize local medical advice over federal guidelines? Share your thoughts in the comments below.